1 out of every 5 children in the U.S. between the ages of 5 and 13 is either overweight or obese. Columbia Association had to do something about this, so we developed the Columbia Youth Fit program. Dr. McKay, a pediatrician on Columbia's Medical Advisory Board, is going to tell us more about the program.
What we've seen in the area of childhood obesity over the last 10 to 20 years or so is that there has been a dramatic increase in the rates of obesity amongst children and adolescents. So we have 2 broad categories of designations, overweight and obese. So the problem exists because there's ready access to food and food that is not healthy. The quickest, most convenient foods in our country are the ones that are the highest in calories, the highest in carbohydrates, and the highest in fats. Fresh fruits and vegetables are hard to come by. Soda machines, snack machines, and vending machines that our children and kids have access to do not contain foods that are healthy or that are good for them with regards to calorie intake and provision of nutrients. As a society, our media plays a role as well. The crux of the commercial is geared toward the child. It's geared toward our senses. It's loud, it's colorful, and it promotes foods that are not the healthiest for us. You rarely remember seeing commercials for apples and oranges and bananas and peaches, but the kids see plenty of commercials for cereals and soft drinks and foods that are less healthy for us, fast foods. Another problem with the advent of the gaming industry and movies and television, our kids are spending a lot more time in front of screens and a lot less time moving. Parents also play a major role in this. The parents' lifestyle is busy with work, holding multiple jobs, caring for multiple kids. It makes it difficult to sit down and, 1, prepare a meal, but 2, have the family eat together in a healthy fashion. Food is on the go. Some kids are responsible for getting their own foods. After-school snacks are readily available. The kitchen is usually stocked with things that are not healthy. So one of the approaches that we try to take is to try to have people take a survey of their home and get rid of all the unhealthy foods and replace them with healthier foods so that the kids have access to better choices. And it's hard enough, obesity is rampant in the adult population too for the very same reasons. And so it really requires a whole lifestyle change for the entire family. So some of the things that we see as solutions involve, 1, increasing daily activity on a regular basis, trying to mandate that schools maintain physical education in the schools through high school, to be able to involve kids in community programs that get them to move and get them to be active outside. Columbia Association has now extended their efforts into the youth and adolescents to receive information about diet and exercise so that they can make a more positive impact on their weight management. It is a program that involves the parents as well as the kids, and eventually will span the age range, but for the initial pilot program will be for the 10 to 13-year-old age range. The patients can access the program independently themselves by calling the number on the brochure and/or by asking their physician about the program. But in general, there will be a physician referral process where physicians will send in information to the program, have parents contact the program, and that method will enable kids to be enrolled in the activities. The program will span 6 to 8 weeks and will be dual education for both the parents and the patients at the same time, where they will receive age-appropriate information about diet and nutrition and exercise, while the parents are receiving education about how to feed their children better, how to select foods better. The kids are receiving the same information in an age-appropriate fashion, and then also provided with an opportunity to learn different exercise techniques and different exercise methods that they can use to improve their fitness level.
Each week during the program, children and parents are going to start out together. They're going to learn the theme for the week, and then they split apart. The children are going to do quiet activities so they can understand the theme better, but then they're also going to be physically active, get in those calories, burn those calories, get excited, work together. The parents are going to learn from a registered dietitian and a life coach about how to incorporate these important nutrition and changes, behavioral changes, into their child's daily life. This is a program that is for life, and it's a great one. Thank you. For more information, please contact Shawnee, that's me, at 410-715-3128.